is a phobia? A phobia is an extreme and sometimes debilitating fear or aversion to something. There are lots of different types of phobias, although some are more common than others. Phobias are more than just fears, and someone with a severe phobia might find themselves developing avoidance behaviours to help themselves feel calm. This may affect jobs, relationships, and the person's overall well-being. With a phobia comes the physical symptoms of anxiety. These symptoms include nausea, sweating, palpitations, shortness of breath, shaking, an upset stomach, and more. Some may not realise how severe their phobia is if they don't come into contact with the source of their phobia very often, and they may find that it doesn't affect their everyday life. The two types of phobia are specific or simple phobias and complex phobias. Specific or simple phobias focus on one particular thing, for example, an animal or object. Arachnophobia and a fear of flying would fit into this category. Complex phobias usually develop during adulthood, and the anxiety can lead to avoidance behaviours. Agoraphobia is a complex phobia. It means fear of the outside, but it can lead a person to be afraid of many different situations, rather than something specific. Another example of a complex phobia would be social phobias. If you have a phobia that is affecting your everyday life, you should visit your GP. It may seem impossible to imagine life without it, but there is treatment available for phobias, and you can improve your everyday life. Someone with a specific or simple phobia may find it hard to believe that there is treatment available for them. Specific or simple phobias are phobias with a focus on a particular object, animal, or situation. Examples of this may be trypanophobia, fear of needles, arachnophobia, fear of spiders, or acrophobia, fear of heights. Today, we'll talk about the treatments available for specific or simple phobias. The first step towards treatment is to ask a GP for a referral to a mental health service that can help with phobias. Some mental health services also accept self-referrals. Talking therapy is most likely to be offered, for example, cognitive behavioural therapy, also known as CBT. CBT helps to change the way you think and behave. The aim of CBT when treating a phobia is to help change a person's thoughts and behaviours around their fear so that they can manage it more practically. Depending on what the phobia is, exposure therapy may be helpful. Exposure therapy is a very gradual way to help someone face their fear. It begins with a very small level of exposure to the fear, for example, to look at a picture of what the patient is afraid of. The patient experiences a small amount of anxiety, but can also eventually feel the anxiety reduce. The final step would be to come into direct contact with the subject of their phobia. We show how this works in our program, Phobias, a case study, in which Rita, our patient, overcomes her phobia of birds. There's a link to this program in the description box if you'd like to know more.